Chapter 13. How Pharmaceutical Overreach, Corruption and Health System Failures Birthed COVID. Dr. Aseem Malhotra, British cardiologist. Dr. Aseem Malhotra is an NHS-trained consultant cardiologist and visiting professor of evidence-based medicine, Bahia School of Medicine and Public Health, Salvador, Brazil. He is a world-renowned expert in the prevention, diagnosis and management of heart disease. He is honorary council member to the Metabolic Psychiatry Clinic at Stanford University School of Medicine, California, and is cardiology MSc examiner at the University of Hertfordshire, UK. He is a founding member of Action on Sugar and was the lead campaigner highlighting the harm caused by excess sugar consumption in the United Kingdom, particularly its role in type 2 diabetes and obesity. The following chapter is being read for the author by Aidan Whiteock.
For societies to progress in a cohesive manner, people need access to the truth and to be able to trust each other. What are the barriers that are inhibiting our ability to access the truth, and therefore leading to more divisions in society today? I think the current situation we've been in the last few years with the pandemic has probably taught us quite a lot about how important truth is. So I'm going to start by addressing the issue of psychological barriers, because I believe that science alone isn't enough. Opposition from powerful vested interests need to be overcome. The first psychological barrier I want to share with you is one of willful blindness. This is when human beings, we're all capable of this, turn a blind eye to the truth in order to feel safe, reduce anxiety, avoid conflict, to protect prestige, egos, and reputations. Another barrier to us getting the truth is one of fear. If we are gripped by fear, many of us, most of us to some degree, were gripped by varying levels of fear with the COVID pandemic. That inhibits our ability to engage in critical thinking. What's worse than ignorance? The late great Stephen Hawking teaches us the illusion of knowledge. I'm a practicing cardiologist. More than anything, I'm interested in health, in trying to improve my patients' outcomes. This is a really nice definition of health. It was coined by the World Health Organization. They're not in my good books at the moment, but actually their definition of health is a wonderful one. It is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Why are we not achieving this? Why in the UK has life expectancy stalled in the last 10 years? Why are more and more people living with chronic disease? We are regressing mentally and physically worldwide. The question is why? As doctors practicing and teaching medicine, the analytical framework that we use is the evidence-based medicine triad. In order to improve patient outcomes, manage risks, treat illness, and relieve suffering, we need to incorporate these three components. Our individual clinical expertise as doctors, our knowledge, our experience, our clinical intuition, the best available evidence, and last but not least, the most important thing is incorporating patient values and preferences. In other words, informed consent. To have informed consent, people need to have all the information given to them. Consent that isn't fully informed is not consent at all. The problem is that over the last few decades, evidence-based medicine has become an illusion. Evidence-based medicine has been hijacked by powerful vested interests. The best available clinical evidence has been corrupted, and if doctors are making clinical decisions on biased and commercially corrupted information, it doesn't take a rocket scientist to figure it out. At best, it's going to lead to suboptimal outcomes for patients. At worst, it's going to do harm. Now, we have complete healthcare system failure, and a pandemic of misinformed doctors and misinformed and unwittingly harmed patients, based upon a number of factors. These factors are biased funding of research that is funded because it's likely to be profitable, not beneficial for patients, biased reporting in medical journals, biased patient pamphlets, and biased reporting in the media. This is a big, big issue. Combine the status quo with commercial conflicts of interest, defensive medicine, and last but not least, medical curricula that fail to teach doctors how to comprehend and communicate basic health statistics. John Ioannidis is the most cited medical researcher in the world. I call him the Stephen Hawking of medicine. He wrote a paper in 2017, How to Survive the Medical Misinformation Mess. He makes some very clear, important points I think people need to fully acknowledge and understand. Much, if not most, published research is not reliable, offers no benefit to patients, and is not useful to decision makers. Most healthcare professionals are not aware of this problem. One of the barriers to overcoming these system failures is awareness. Most doctors are not aware. They then lack the necessary skills to evaluate the reliability and usefulness of medical science. To listen to the remainder of this essay and the 33 other essays, please visit Audible, Apple Books, or Amazon to receive your copy in print, ebook, or audio. Thank you.